And now I'll call on Amrita Parmar, who is a nurse who has worked in Burnaby, British Columbia in geriatric care for the past 5 years. Thanks so much for joining us, Amrita. Take it away.
Hi, everyone. Thanks for joining on this webinar. I'm just going to be talking mostly about my personal experiences working as a long-term care nurse. I'm going to be reflecting more of a personalized story of what Dr. Ahmed, Faiz, and Simran have been discussing a little bit more abstractly. And so I've been working at this assisted living facility for last few years. It is a privately owned company that runs this building. We do get, this is in British Columbia, but we also get a majority of our funding, or actually probably 100% of our funding from the Fraser Health Authority here. And it's a 19-floor building with 200 residents. I'm the only nurse in the facility, and there's about 4 care aides on at each shift in intervals. I generally, so when the pandemic started, we were really working to the bone. We were really, really stressed out because we were getting a lot of information, a lot of new policies coming in every day to do this, check this, send us this documentation, make sure, you know, we're wearing this and that, right? And by the first few weeks were really just full of anxiety, a lot of stress. So right now we are maintaining a vigilance to prevent an outbreak, but we are a little bit more calmer, I would say. We're doing a little bit better since I think so the beginning of this month, we almost ran out of masks. We almost ran out of surgical masks. We were one weekend I was working, and we had about, I think 30, 40 masks left, but then it was the Easter long weekend, and I was worried that we would end up having to use one mask for every couple of days. What we were doing instead was we were doing wearing one mask at the beginning of the shift, and then we would dispose it at the end unless if you drop it in the middle of your shift, or if it's dirty, if it's wet, that kind of thing, then obviously you throw it away. But right now it's more of just a calmer system where I also want to mention that we do have, like Simran was saying, they're all women of color mostly, and all the staff, there's not a single male care staff. We have dining staff who are male and some in housekeeping, but all the rest of the care staff are actually only female, and 99% people of color. We have limited sick leave days. So last month I got sick. I thought it was the coronavirus, but it was probably just a regular cold. And my manager says, oh, you ran out of your sick days, so you just apply for EI. And I'm thinking that I'm working full time here and I somehow ran out of sick days. Casual employees who are employer get no benefits, no sick leave, nothing. If they are sick, then they don't get paid for not working. So it's kind of a terrible system. I did hear that the government is collectivizing the agreements, the union agreements under the BC Nurses Union to include, to increase the pay for anyone who's working in private facilities too. But my worry is that we won't get the workers' benefits. So it kind of reduces the incentive to join a union if you get the union wages, because the point of the union is, of course, so that I can go to my representative and say, hey, my boss isn't treating me right. I don't have fair working conditions. Can you help me out? But if you already have the pay, then you're just going to, I think, stick with what you have and not just keep silent for that time being. Moving on, I want to talk more about the mental health aspect of our workplace as well. So I talked about the staff members. We have been on high alert, but we're doing better now, managing well. but the residents are, since starting Friday, we literally just lock them in the building, or like, you're not allowed to leave. Only the smokers are allowed to leave through a side door so that the other residents don't see them and get jealous or something. But a week and a half ago, there was a resident in my building who, I think she lives on the 15th, 16th floor or something. There's 19 floors in total. And she tried to commit suicide. She tried to jump out the window because she already had anxiety. We told her she had to isolate because she had some respiratory illness symptoms. We ended up having to call the police, and then it was a whole thing. And and then yesterday morning, I arrived at work at 7 in the morning, and there was a resident who, he's a big, tall guy, and he tried to barge through the front sliding doors to get out because he has dementia. He tries to go out every day, but what happened was he didn't understand what's going on with the coronavirus pandemic, and a lot of my residents don't understand what's going on. They don't get it. They're just like, the staff are wearing masks, okay, new change, but whatever. They don't understand that this virus is literally going to kill them. So on top of dealing with the stress of not having enough paid leave, the stress of not having PPE, the stress of managing my staff and all that sort of stuff, and what Fraser Health is sending us, I'm trying to manage the mental health of my residents, make sure that they literally try not to kill themselves while isolated in their building. But it's only going to get worse from here, but we're trying to do little things like, I don't know about other facilities, but we're still trying to maintain our activity level as much as we can by having, say, 10 residents at a time in the penthouse floor and doing some sort of activity. We do little dance parties just before lunch in their rooms. They play music and then they tell them to dance so that they stay fit. But another aspect of the workplace right now is a safety aspect where we are not allowed to transfer any of the residents anymore unless it's like extenuating absolutely circumstances. I tried to call the ambulance for a resident who was bleeding for 2 days from her nose, just dripping repeatedly. And the paramedics came, and then they refused to take her because they said the risk to take her to the hospital was higher than her continuously dripping blood in my facility. She was fine in the end, but there's another resident who's, so some residents need to be transferred because their abilities have decreased so significantly that we can't provide the level of care that they need in our assisted living facility. But since we're not being able to transfer these residents, there was an obese lady in her room. She's not able to stand anymore, but we need to make her stand so that we can literally wipe her bum and like put a new pad on and sit her down again. And the other staff were not as strong, I guess, and so it fell to me to help heft her up, risking a muscle strain or injury, and then like holding her for literally 5 minutes while the other staff member do their thing. And I think that's one other thing I feel like the media or whoever doesn't really talk about is the safety aspect of the mental health, and also but what we're doing to manage these residents who are deteriorating, but we can't get the adequate resources that we need that we previously had. Everybody knows about the PPE, that of course everyone's having shortages, and we did receive a huge shipment a couple of days ago, which is okay. But yeah, the problem is a lack of staffing, and for sure, if we had enough staff, we could probably help with that. If we had more funding, we could buy more machines, which is a mechanical lift to lift these residents up. There's just so many things to this crisis that a lot of people, although they're touching on, that are still being missed. And yeah, so in just to end this, otherwise I'll probably still ramble on with all my stories. I want to conclude by saying that if you're thinking of donating to a healthcare facility, one thing as a nurse I would love is if people donated things like hand lotion, maybe store-bought gloves or surgical masks, and just continue to advocate for the government to increase spending for, increase the funding for the healthcare system so that we have the machines, we have the supplies that we need to properly care for your mother, your father, your grandmother, your grandfather. Thank you.
Thanks so much, Amrita. That's just incredible frontline experience. Thanks for sharing that with us. So Amrita, would you like to give us your closing thoughts and comments? And we'll just unmute.
Hi. Yes, so sorry. So I think I just want to say thank you to everybody who is speaking about this crisis, and in every capacity, on the financial side, on the personal side, and it's just amazing what you guys have put together. I think we really needed it at this time. One other last comment I wanted to make was that so while people like us, the healthcare workers, are risking our health and safety, our Canadian government is still giving billions of dollars in subsidies to the oil and energy sector, and we're getting wage subsidies to other businesses. Instead, we should be having, like we keep discussing, we should have more paid sick leave, we should have better wages, more funding, we should have properly housed people. We should have absolutely zero homelessness right now in this crisis. Even one person, it will spread like wildfire if one homeless person catches the virus. This is the time that the government needs to be really thinking about. Does it really care about its citizens, or is it really going to let people die in order for the corporations to have profit?
Thanks, Amrita.